It is really tough breaking bad news. There is a risk of the back of the eye retina to detach, and that causes blindness.
One of the advantages of being a GP is to have that long-term relationship with patients.
I've got to last until my Charlie gets through medical school and graduates.
Okay.
If you can make people smile or laugh, they're able to relax in your presence. That is just the most disastrous looking toe I've ever seen.
Looking at your ECG, I think we still need you to be seen in hospital today, okay?
Barnum Surgery, Pam, how can I help?
Hello, darling. Come in.
Thank you.
You saw Dr. Bolger, didn't you?
did,
Yeah.
yeah.
And she's put on here we need to repeat your liver function.
This is the best one.
That's good. Oh, yeah. It's a whopper.
Yeah.
I like that.
As long as you leave me some.
Has nobody seen this yet? Has anyone seen it? No.
No. It doesn't bother me, except if I touch it there, which is the point of contact with the floor.
Yeah. I don't check the faces, but I'd be inclined to put you in to see the emergency doctor this morning.
Maybe you'd better check it out.
I would prefer to, have the doctor have a look.
Okay.
Right, me darling. Nice straight arm.
Just seems like a fight he No, he's parked right in the middle of the car park. I couldn't get into any of the spaces.
Oh.
He won't move because he's waiting to pick
What, in here?
up in the doctor's park.
Oh.
Emily Angel, please. Hello, come in. I'm Dr. Sheikh. Have a seat, please. Right, how can I help?
Yeah, we were here Monday.
Yeah, I just see that,
The
yeah.
rash, it was just on her tummy.
Yeah.
And we were prescribed Piriton.
Yeah.
Told to just do 2 meals twice a day because she's not really supposed to have it yet.
Yeah.
But it's not working, and the rashes, as you can see, it's all over her face, her arms,
Yeah.
legs,
Well,
feet,
just still
and
smiling,
everything.
yeah. Okay.
And he did say if it gets worse to come back, and it's
Okay.
obviously got quite a bit worse.
Shall we have a look? And feeding-wise?
She's been okay with her milk, but not so much actual food.
And having wet nappies, that's normal? Yeah.
Wet nappies.
Okay, why don't you take off all her dress and accept the nappy?
Okay.
Okay.
Yeah.
Yeah, you hold it and I'll have a look at you. Okay. Apply pressure, they disappear and then they come back.
Yeah. Sweet.
Now you want this toy, this is mine. Yeah? You want to be a doctor? You want to grow up and be a doctor? Okay. Okay. So you can dress her back before she gets too cold.
Yeah.
The rash that she has got doesn't look like an allergic rash. Okay. So you can stop the Piriton actually.
Okay.
Right? So it's not a worrying rash. She's well in herself. She's not got a temperature.
Yeah.
If the rash changes in appearance or if you're worried for any reason, bring her back.
Yeah.
The only other thing I wanted to mention, while I was having a listen to her chest, I did hear a little extra sound in her heart, okay, which is nothing to worry about. Again, we sometimes see this, which we call as an innocent murmur.
Yeah.
Sometimes babies, when they're unwell, they get a murmur and then it kind of, resolves on its own. But I don't want it to be missed. So I'm going to write to the pediatricians to have a look at her.
Okay.
High five?
High five.
Do you feel reassured? Yeah?
Yeah, it's fine.
Okay.
Thank you very much.
Do you want to hold that? Yeah. But don't
eat
tear
it,
it
won't you?
and don't eat it. Yeah. You're welcome.
Thank you very much.
All right. You take care. Bye-bye.
Bye-bye.
Come on in, Sarah. I'm Dr. Bolger. We've met, I think, haven't we? Okay, so how you doing?
Levels are still there everywhere.
Right, because we... have you had bloods done or not? Here?
Not recently.
No, the last one we've got is horrible, but it's a long time out of date. You're due some more, aren't you?
I think so, yeah.
Yeah, okay. And they are everywhere, aren't they? So they're all... There's loads of 20s, yeah? There's no lows that I can see there. Are you having any hypos?
I had one just before I come.
Today?
Yeah.
Right. Are these any better than they've been?
Yeah, it's everywhere still.
Okay. You know that I need the diabetic specialist to have a look at you for this, yeah?
Yeah.
And we need them to see you sooner rather than later, don't we? Tell me how much insulin you take.
Well, I take 11 in the morning, and then I have like between 18 or 24 or 26 of the Humalog with the 11 in the morning.
And then at lunch?
It's about 24, 28. I put it up to 28 lately.
And what about your evening meal? Is that your big meal of the day?
Yeah, if I have that, I take about 30 of that.
Are you not eating regularly?
No, I've gone off my food for about 3 months now.
Do you know why?
I'm suffering from depression as well.
Mm.
He had a bit of an accident at the weekend.
Did you trip?
No, I just didn't realise my step was that big.
I did go backwards and forwards, and I said, ow, that hurt my back.
What happened?
That, well, apparently I don't remember going from the top of the stairs to the bottom, but apparently my manager said that I'd fallen.
Oh, you had a fall. Oh, dear.
I fell downstairs.
At home? Oh, gosh. Come on through. How can I help?
Well, I fell and down my...
Yes.
Everybody says I have to have it checked out. To see
When did you fall?
On Saturday.
Saturday. What happened?
Well, I was coming down the escalator in the shop.
Yes.
With a trolley to turn it round. Of course, the escalator doesn't stop.
Of course.
It keeps going.
Yeah.
Taking me with it.
Oh, bless you.
And I couldn't stop myself.
Is it painful?
It's only if I touch it. It's not that painful now.
Yeah.
You know, the pain dies down. But I saw a chiropractor yesterday because I see them for my arthritis. And then I saw the nurse this morning to give my blood sample, and she said, I think you should have that.
Oh, all right.
So they both said, have it looked at.
Because you're on aspirin, aren't you?
Yeah, that's why I'm
That's
all
sore?
black and blue. Yes.
That bit sore there.
Yeah.
There's no bleeding from the nose or ears or
No,
anything?
no.
Good.
Ow. See that? I think it's the cheekbone.
Yeah.
Actually, it's probably bruised, you know, something like that.
It's all bruised around here,
Yeah,
bless
no,
you.
doesn't look awful. And it will take ages to get better.
A few weeks,
I know it will.
You didn't lose consciousness when you fell?
Oh, no, no.
Other side? Okay, good. I think it's just badly bruised.
Do you think so?
Yeah, I don't think you've broken anything.
No, that's what.
But because you're on aspirin, it does make you bruise more easily.
Yeah. Spoiled my beauty completely.
Oh, I know, you poor thing.
I think I had them bad enough to start with.
It will get better. We just got to be patient.
Eventually, yes. Anyway, I'm sorry to take up your
No,
time,
no,
but it
not at
wasn't
all.
my fault.
Better safe than sorry, though.
Well, I suppose so, yeah. Anyway, thank you very much.
That's all right.
Yeah.
Take the lift, okay?
Okay.
Don't want you falling down the stairs now.
Bye-bye then.
Bye.
You don't like your dead, Mum?
Huh?
You don't like your dead?
I'm really tired. I'm really tired. I was in bed at 9 o'clock last night reading my book, and then Dad drank a full bottle of wine, which made me cross. He then fell asleep, missed the football, and it was my favourite that I'd had half a glass out of, so now there is none of my favourite. It's beautiful, beautiful Shiraz, and then I went down to get a glass and he drank it all, and that was half past 10. No, I told him to stay downstairs because I wasn't putting up with him constant snoring, but he came to bed, so I went to bed in a mood.
What are they doing about your depression?
I'm 40 mg of citalopram at the minute.
Have you had any talking therapy? Would you like to? Is there anything going on that you need to talk?
No, I'm just not motivated to do anything. I don't know what's in particular.
So there's nothing particularly worrying you? Would you like to talk to anyone about the diabetes? Because that can be tough, living with a long-term illness, can't it?
Not really, I'm just fed up of it being high, but I guess everyone gets fed up.
Some people find the confines and the complications of something like diabetes very difficult to deal with. It's a lifelong diagnosis and it affects nearly every aspect of your life. Having a chronic condition makes you depressed, and being depressed makes managing a chronic condition much more difficult, and the two are very definitely linked. I'm going to send you back to the diabetic clinic. There's blood tests on the system. Will you book them for me, yeah? Here, yeah. In fact, let's get you a blood test now, and then I can send you back to them when I've got the new results, yeah? If you change your mind about talking to someone, if you change your mind about talking to anyone around the diabetes, you get a message to me? Are you seeing anyone again about the citalopram?
Not that I know
of. What about hurting yourself?
No. I had a hypo at the end of March.
Sarah had several admissions which have been directly related to her uncontrolled diabetes. Hypo is when your blood sugar drops. So if you think about when you feel really hungry, that horrible empty feeling, but magnify it so people feel trembly, shaky, sweaty, often become confused. In its most extreme forms, hypoglycemia will lead to coma and, if untreated, to death.
I don't have the intention to hurt myself, but if something like that happens, so just let it take its course, basically.
That sounds horrible. You've been diabetic long enough to know that if you're not looking after yourself properly, then you are at risk of hurting yourself, aren't you?
Not being able to eat, but I'm forcing myself to eat now.
Not taking control of diabetes, not managing your diet, it's self-harm by neglect. So diabetics who are struggling with motivation will often say that they wouldn't deliberately do anything to hurt themselves, but sometimes they really just can't be bothered, and they're aware that that will then have an impact on their health. What should we do next? What could we do next to help with that? Why not talk to someone?
Not really anything to talk about it before, and just fed up.
You think it's tied into diabetes? Might be an element of chicken and egg, mightn't there? You're feeling rubbish, so it's hard for you to keep on top of your diabetes. Your diabetes is rubbish, so that makes you feel depressed. Will you come back and see me after those blood tests? And will you stay on the citalopram until then? And if you change your mind about talking to someone, will you let me know? You don't have to wait for the appointment to do that.
Okay. Just phone up and say, can I make an appointment with Dr. Boulder?
Yeah, just phone up and say, I'd like Dr. Boulder to give me a ring. And we crack on and we get the diabetic people to see you and try and bring your sugar down. Does that sound like a reasonable plan? I will expect to see you in a couple of weeks, yeah?
Yeah, that's easy.
Bye-bye.
Can someone grab me some paper towels? Lady's collapsed in the street. Sheila's with her. I think they're going to be okay. They're going to bring her in. Thank you. Thank you.
Hello. How are you today? I understand you had a panic attack in the workplace, is that right?
I was on my way to work.
Oh, okay.
I don't know what happened. I was fine in the morning. Dropped my kids off as per normal. I was driving. I started to feel my legs just started shaking. Hot and cold flushes. I could feel my just chest and everything just burning up. And then my hands just started to freeze. I couldn't change a gear, so I just pulled up. And then I called my manager, who then, while I was on the phone, I was sick, and then she just called the ambulance. But they've given this now. But
let's have a look. How are you feeling now?
Still on and off. Like, I'm getting hot flushes. I can feel like just steam coming out of me.
Yeah. So you think this is probably panic attack? Yeah.
I don't know. Maybe, I don't know.
Let's check. Give a few checks today. Check your temperature, listen to your chest, and look at your throat and see what's going on. And take it further from there. Just going to... No, you don't. It's not panic attack. It's your temperature, 38.2. So that's why you're shivering and feeling very cold and hot and sweaty.
Right.
It's a big I don't tend to use this, but I may need to because you're not opening your mouth big. It's a big okay, that's good. Quick listen to your chest. Thank you. Oh. The chest is all below clear, and the upper areas, there's some harsh breath sounds. You're coming down with a viral illness, and that's why you're feeling this way. The throat can become much more sore and dry, and you'll have mucus coating as hours pass by, and you feel a lot more unwell as well. So start taking Nurofen and paracetamol. Drink plenty of fluids and take good rest at home. There's nothing else sinister or serious going on as such. Yeah, and it's not panic attack or anxiety attack.
Okay.
Is that okay?
That's fine.
Yeah, you're feeling miserable and awful, but hopefully things will get better. Okay?
Thank you.
All the best now. Take care.
Hello, Dr. Roche. Thanks for waiting. How can I help?
I've got 2 things
Uh-huh.
in my foot. I've used the wart cream as well.
Yeah, okay.
And
Yes.
this one is quite
Yeah.
painful
Yeah.
as well. And same as
Yeah,
this one.
okay. The treatment for this is to buy something called duct tape. And you put it on, cut a little piece off, put it over it, leave it on, and usually within 2 to 3 weeks they go away. And it's twice as good as the stuff in the chemist or freezing it or anything else.
And I can find it on the
So, okay, good question. So a hardware store, places like, B&Q, Wix, those sorts of places. You need a smear. You know a
I
smear?
need a smear?
Yeah, that's what it's saying, you need a smear.
Oh, it's been 5 years now.
Well, it's every 3 years you need it.
Is it?
Yeah. If you make your point on the way out, that'd be great. For that. Okay. Sorry. It's best to have one, though.
Thank you very much.
Okay. Bye-bye.
Hello, sorry to keep you waiting, my lovely. How can I help?
Good afternoon. Come and have a seat, sir. Hello. So, how are you today? How can I be?
My little boy, he got a white spot in his pupil, a left eye. He had been checked. We went to the Oxford Eye Hospital. He sent the fax over here and the post as well. So we want to discuss with you.
It's just on the left that you're noticing?
Yeah, left, yeah.
Yeah, I think it might, but not necessarily be that you can get something called a congenital cataracts.
All right.
So they get like a whiteness, which I think is what you're seeing. So I'm going to write a referral.
Oh, all
so
right.
you should get something in the post.
Okay,
At
from the eye specialist.
From the eye specialist, yeah.
Basically, looking at this, it's not just the cataract. Behind there is blood vessel formation and hence not a completely developed eye. And nothing sinister or cancerous, but he has advised against having a surgery. But I totally understand your concerns about whether there will be somebody out there else who could give a different opinion for a different, better prognosis and outcome. Initially, what he says is that by doing surgery, there is a risk of the back of the eye retina to detach, and that causes blindness.
I take it you're going to abuse me with your needles.
Yes. Torture time. Okay, just try and relax that leg. Just let it flop as much as you can, okay? Prick now.
cushion.
That's right, yes.
Yeah, you must feel like a pincushion, do you? All these injections.
You make yourself comfortable, because I'm about to shock you with the needle.
Can you take blood without needle, please?
Okay, sorry. Didn't even flinch.
It feels like nothing.
Exactly, that's how it should feel.
Oh dear. In we come. In we come. No John today? Have you got your new teeth?
Yes.
God, they're much better than the old ones.
I know they are.
You look great. Are you happy?
Yes.
I think they're great. Oh, that's very
Thank
kind
you.
of you. That's very kind of you. Let me get this chair out. I've known Peggy for probably 17 years. As soon as I started the practice, I got to meet her. She suffers badly from quite extreme osteoarthritis, which has affected most of her joints over the years, particularly her back. And when I started doing acupuncture as a treatment, then she seemed to be a perfect client for this type of treatment.
Before you start sticking me, this calf
Yeah.
has really been hot and swollen.
Yeah?
And but I don't know whether I've overdone the gardening or what I've done.
How long for?
Well, it's just about cooling off now.
Okay. When do you mean by that? Do you mean for the last?
4 days.
Right.
And I haven't been able to do a lot with it.
You can't remember doing anything to it though.
No, oh, definitely not.
No.
I've been doing a lot of gardening. I'm just wondering whether I.
You didn't feel a pull or a snap or anything like that? So I've been using acupuncture now for about 15 years. I attended a course and was a little sceptical after coming out, but I gradually introduced it to my surgeries, and over the years have found that 70 to 80% of people get some effect from the treatment that we give them. If you can cut down on medication, if you can reduce their pain levels, then I feel that it's a successful treatment. God, and the hair's been done as well, isn't it?
Yes. Very noticeable today, aren't you, Dave?
It's not routinely used under the NHS unless you go into a specialist pain clinic or physiotherapist normally. In fact, I think there's only 2 of us in Slough who offer acupuncture as a service, and we do it off our own bat. Okay, let's have a look. Okay, so nice and relaxed, just let everything flop.
See, that hurts. That really hurts.
So all over if I
Yes,
do that, yeah.
Yes.
Any specific point or not? Just
that.
all of it?
All that.
All of it, all the way up and down?
Yes. Yes.
Okay, that's your muscle, isn't it? That's,
Is it? I want to talk about my toes. That one there now,
yeah,
that's coming over here.
the overriding one, yeah.
And this one is coming over.
Okay.
Like that. So do I have to phone up and speak to him, or do you have to?
I'd have
refer
to refer you.
me? Yeah.
I mean, the problem with that one is that you've still got a bunion of sorts here. Do you know what
Well,
I
haven't
mean?
had that done, have I?
Exactly. So it's in that direction. So this is a reasonably straight toe, but it's
Yeah.
this one's popping underneath it,
Yeah.
whereas that is just the most disastrous looking toe I've ever seen. Well, it takes a 90-degree turn, doesn't it?
Yeah, it
there.
does.
So
Yeah,
it's
yeah.
so that's very different. So that would be to do something with that joint.
Yeah. I'm quite happy to have it done.
Whereas that one would be, I would be tempted not to do anything with that.
Okay.
Okay, because I think that would involve having to do this whole foot.
Yeah, and I don't want that done before I go away.
But that I think probably needs to. Is it causing pain?
Yes, and especially when I've got shoes, and I can't back to square one again. I can't
Yeah.
have proper shoes on.
All right, madame. What have we got? These sticking out here, 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 here.
So I'll see you about 5 to 6 weeks.
Yeah, I will. So we'll send that off to you, and we'll get you back in
You're
again.
after the-
Yeah. Look, let me help you. Well, what you're doing.
Thank you.
You haven't had a gin today, have you already?
No.
No. Okay.
Okay then, David. Have a lovely holiday.
I will.
Look after yourself over there, please.
I will.
If we don't operate, he might be left with a reduced vision.
So
on
that's
the
when he still
left
can
side.
see.
He can still see. Right side is absolutely normal.
Yeah, I know.
People can function with one eye, but obviously, as a child, you want to make sure everything is perfect with your little one.
Patients rarely ask for a second opinion. They usually trust the judgment of the doctors. In the John Ratcliffe Hospital, the consultant discussed with the parents the pros and cons of doing a surgery to restore the vision. The parents were told that by doing a surgery, there is a likelihood of blindness. Because of that guarded prognosis, the specialist told the parents that not doing an operation might help the little one. Hence, the parents came to see me for a second opinion. Yeah. If you do the operation on such a small eye now, there is always a complication of bleeding and the retinal detachment, and that causes complete blindness. So, whenever the surgeon is putting his scalpel or procedure anywhere, he weighs the options, benefits versus risks. Based on that, they give the advice. But there's no harm in getting a second opinion. Yeah. Parents are always anxious about and want to get the best outcomes for their children. As a parent myself, I feel the same. Getting a second opinion gives the patients extra element of reassurance. If I put myself in their shoes, I would think it's perfectly harmless to try doing that, because following the first opinion may not achieve the best outcomes for them. Hi, this is Dr. Nanda dictating a referral letter to consultant ophthalmologist in Great Ormond Street Hospital, London. The assessment and the first opinion is very detailed and clear. However, the parents are looking for further second opinion with a view for enhancing the overall outcome for the left eye for this little one, and hence this referral sincerely. Okay? So this will go, and the secretaries in the next 1 or 2 days will fax it across to the Great Ormond Street Hospital, and you should be getting a letter in the post within the next week or two. And I'll contact you on Friday after speaking to the Great Ormond Street Hospital as well. Is that okay?
Yeah, that's fine.
All the best for your little one, okay?
All right. Thanks a lot for your help.
Not a problem. Take care. Okay.
Yeah, thank you.
All the best.
How long have you suffered with psoriasis?
Quite a long time.
Okay.
But it's never actually been that bad before.
Where does it affect you normally?
It normally just affects me here, but now it's started showing up here.
Yeah.
Started showing up on my other arm.
So you've got it on your trunk, you've got it on your elbows, I can see. Have you got any sort of in your groin area, genital area?
No.
No? Any in your belly button?
No.
No? Okay. Your ears are okay?
Yeah.
Hair or scalp? Any problems with that?
No.
No? Okay, good. How do you normally manage this?
Well, I've been using creams in the past that just ain't helping no more.
So there are some other things we could try which you've never had before. So one of them is something called Dovabet gel. Does that ring a bell?
No.
So I will give you something that will help to try and accelerate the clearance of this. But it is still important you use a regular moisturiser to soften the skin, because it's what psoriasis is over-thickening of the skin. It's sort of almost, you could call it a defect. It's almost healing and thickening up too quickly. Usually if you do that once at night before you go to bed, that should be enough. But then you need to look into moisturising straight after doing that. Have you used Vaseline, that kind of consistency on your skin? An ointment?
A lot of Vaseline contains like nuts and stuff, and I'm allergic.
Okay.
So I don't want to be rubbing that on my skin and having an allergic reaction.
Vaseline doesn't contain nuts. It's a petroleum jelly. Have you used it before and had a reaction? It's basically an oil-based product as opposed to...
There's like lots of different Vaselines. Like
okay, so what I'll do, I will give you 2 things that I think will be best for you to try. If it works, then it's great. All right? And then I'll need to see you back to see if you're agreeing with it in terms of it's suiting you or it's making a difference.
All right.
Shall we do that?
Yeah.
Okay, see you soon.
Hello, darling.
Treatment at 8:40 with the nurse.
Right. Blood test or...?
Blood test.
Hi, June. It's not. It's not a permanent move. It's just for this morning. So is it better for you being this close?
Well, for me it will be, but I mean, I'm just one. I'm staying here.
Okay.
This is the appointment you told me not to cancel.
Good.
I am slightly worried about my theophylline level, having been told it's gone over 20. And my shakes are getting pretty every day.
June's main problem is chronic obstructive pulmonary disease, COPD, and the problem it's given her over the years has been progressive shortness of breath, to the extent that this now is limiting her life. June is on quite a lot of medication. Theophylline has an anti-inflammatory effect to open up your airways, help you breathe a bit better, and also an effect to relax the muscles that we've got in the bigger airways in the chest and in the bronchioles. The problem with this is that if you give someone too much of it, you get too much of the effects. So your blood pressure goes up too much, your heart beats too fast, and you start to feel really quite unwell. Do you think the shakes are caused by the theophylline level being high?
Well, I take my tablets at 8 o'clock. The shakes start. It's like a caffeine rush, you know, when you're shaking inside.
Yeah.
And I've noticed recently, which is unusual, that after I take the theophylline at 8 o'clock at night, for about an hour I get slight shakes again.
How's the breathing been?
It's not as good as it was. I mean, at this time, with this steroid course, it's gotten a lot better. I don't know if it's just me, but I think it's beginning to creep into getting worse again.
What would you like to do about the theophylline level?
I'm in your hands on that one. I know it's a dangerous drug.
It comes down to the fact you are having side effects. Would you like to...
I'm capable of putting up with these side effects until I finish my steroids. See how we go on that one.
Right. So that brings on the issue about tapering off the steroids. We often use steroids for conditions in which we want to damp down a patient's inflammatory response, such as eczema or asthma or chronic obstructive pulmonary disease. Steroids, really useful drugs when used properly in the right dose. We do worry about patients who have higher doses for longer periods of time, because that's when you then start to have the side effects from them. So what do you want to do about that this time?
I really don't know. I haven't got a clue. I cannot cope with not being able to breathe, to look after myself.
I can only imagine how bad that must be.
Because what I find at the moment with the steroids, it gives me the get up and go before it affects my breathing getting better. As my breathing, shortness of breath gets worse, my get up and go disappears out the bloody window. The fact that I can cope with it goes out the window. It's a bit of a vicious circle.
Are you still having pain now?
No, it's eased off now.
It's
I
eased
say
off
that
now.
way. That pain was, I've not had it for about maybe 4 or 5 years. That sort of pain.
Really? So it's more severe than usual?
Normally it just goes, and I take my spray and it's gone.
What time roughly did it happen then?
I would say about 5 to 3.
5 to 3, okay, fairly recently. Yeah, okay.
I phoned the hospital.
And prior to that, you said you don't normally get pain this severe.
No.
How often does your angina pain normally affect you, though? Is it something that do you normally have to use your spray most weeks?
Yes, normally I have to use my spray. I go through quite a bit. Because I'm waiting to see the heart specialist.
Okay, fine. Apart from your inhaler and your usual medications, have you taken anything else today?
No, the only other new medication I have been taking is I was on citalopram, 40 milligrams.
And this pain, when you had it, did it move up to your neck or down your arm, or did it?
No, my arm went stiff. I know that. It
went stiff.
It happens quite often that way. That's why I took my pressure.
Okay.
Straight away.
So listen, what I'd like to do is do your blood pressure.
Right.
Have a listen to your heart.
Yes.
But I think what we also ought to do is get an ECG done. Yeah, you know what they are?
Yes,
the
I've had it,
stickers,
like,
yeah.
you know.
So one of my colleagues down the corridor will do that in a second. Let's examine you first, okay?
I really thought I was going to black out. That's how bad it got.
Really?
A double vision. That's not bad for me.
I mean, that's good.
Yeah.
But I'm still a bit worried.
Yeah, I know that.
Okay.
I'm
Especially
really
because you know in yourself what is a normal angina pain, and for you this was severe, wasn't it?
This is severe.
And it sounds like it's been happening fairly often recently as well. I think today we need to do a blood test in hospital.
In hospital?
Yeah. So there is a blood test that we can sometimes do called a troponin, because sometimes you can get things can become unstable, and you know I really don't want you to have a more major episode than this weekend. Okay. So let's get an ECG done, and then we can have a chat about giving the hospital a call and getting you seen there today.
Okay.
Yeah?
Yes, sir.
Okay. So if you just stay here for a second, I'll just confirm which room's free to have it done. All right?
A couple of days ago I started getting chest pains all around here. And then it started happening again today at work, and then I started getting pain down my arm.
Lovely, let's have a listen to the heart.
I saw you were admitted to A&E because of your heart racing. Is that right? Yes.
I think I can see a surgical scar over
It's
here.
an aneurysm.
Okay.
Are you having any chest pains now?
No, I'm not having chest pains. The only feeling that I have is this of missing of heartbeats and then a discomfort feeling, that's all.
Yeah.
Okay. Thank you.
Thank you.
All right, let's have a look at this. So, looking at your ECG, I think we still need you to be seen in hospital today, okay? So what I'm going to do is call Wexham Park, let them know your story and what's happened today. Okay. Hi, it's one of the local GP registrars in Farnham Road Surgery in Slough. Hi, I've got a gentleman with me who had a particularly severe episode of angina this afternoon. He is known to have ischemic heart disease, but this was a particularly severe episode for him and more prolonged than usual. So I think really he probably needs to come in and have a troponin and a repeat ECG. Okay. Thank you. Bye. I'm going to give you a letter to take with you as well.
Thank you. Okay.
Okay?
Thank you for all your
I wish you all the best.
Thank you very much.
All right?
For all your help. Thank
No
you.
problem. Take care.
If you wanted an ambulance for cardiac arrest, which this is, here from the surgery, what's the number you're going to dial? You need 9 for an outside line, then it's 999. In the heat of the moment, people forget things. Different places may need 9 for an outside line, some places don't. Let's do compression then. One hand, centre of the chest, other hand on top. Get yourself comfortable. Go for it.
It's a bit of a vicious circle.
And is your breathing okay at the moment on the floor?
Yes, it's okay at the moment, and I'm coping. And then you keep finding things wrong.
Yes.
It's not helping.
Not helping, yes. Maybe we should just stop looking.
I think you should. I keep telling you this.
Yeah. Patient's always right. We should listen to you, yeah.
I've got to last until my Charlie gets through medical school and graduates.
Okay, when's that going
And
to
at
be?
least one of my grandchildren gets married.
So what are we talking about? 10 years?
Yeah.
Okay. 10 good years, not 10 years of being looked after, but...
No nursing homes whatsoever.
Mm-hmm.
I'd rather die than go in. So, yeah, quality of life.
Right, okay. So the plan, then, is... For the moment, let's keep on the same dose of theophylline and just see how you are with the side effects, and we'll repeat the blood test and make sure it's not creeping up. Do you want to come back next week and see how you are and discuss it again?
I think, to be honest, that's too soon.
Okay, 2 weeks.
Yeah.
Okay. Is there any chance you can actually read my doctor's writing there?
What the hell did they say about you at school?
Yeah, but that is my absolute best.
God almighty. Do they teach you to write badly?
There's 3 reasons why doctors write badly. Number 1, we rush. Number 2, we can't spell the medical words we're writing. And number 3, if you can't read what we've written, we can always say it's something else we wrote. Yeah, that's why it's all typed now, so you can't deny what we've written. And it corrects the spelling for us.
Right.
Okay, nice to see you. See you 2 weeks' time. I hope things settle down for you.
Okay.
Okay, take care. Bye-bye.
Bye.
Hi, you're right. Is it right to put this down?
Yeah, completely. That's fine. I'll have a seat.
Basically, I just booked this appointment because I had it's called medical yesterday at work.
Okay.
And come out on my hearing test was pretty bad, and they said maybe we should come in and advise with a GP. I thought come and get it out of the way. It looked scary. Basically, I just looked at this in category 3, and I was just like, well, that must be bad.
Okay.
And obviously, I have a few people at home, your hearing's not so good. They're always telling me
Yeah.
maybe I should do something about it, kind of thing.
Okay, so how long have you noticed that it's not been so great?
I ain't really noticed.
Okay.
It's everyone else. That
So
really
you don't have a
notices.
problem?
I don't really have a problem.
Okay.
It's just sometimes I do struggle to hear certain distances and stuff like that, but it ain't really bothered me up until the point of having this check, really.
And have you had any problems with your ears earlier on in life?
No, but my family have.
Hearing loss can be hereditary or it can be acquired. That's why it's important to ask about our family history, as families have many things in common, such as genes, their environment and their lifestyle.
My brother, he's had his grommets done, and my dad's got bad hearing, my sister's got a hearing aid as well.
Okay.
So, yeah.
Fine. Okay, so I'm going to have to take a look inside your ears.
Yeah.
So what job do you do?
I'm a binman.
Okay. You are at higher risk of developing hearing loss if you work with noisy equipment. This is known as noise-induced hearing loss and occurs when there's damage to the sensitive hairs which lie within the ears. Just have a look in one, sorry. There's definitely no wax in there. Sometimes that can cause a problem.
That's what I originally thought the problem was.
Yeah, and I can see down to the eardrum, and they both look okay. So don't know what's going on. So what I'll have to do is I'll have to refer you to the ENT specialist for them to investigate this further and see what's causing it. Okay.
Yeah, that's fine.
All right.
Will I get a letter or?
You'll hear from them directly. Okay. So anything between 6 to 12 weeks.
Yeah, I appreciate that. Thank you very much.
Okay.
Happy everything, yeah?
Yeah, that's fine. Take care.
Lovely.
Bye-bye.
Cheers.
Bye. Bye. See you later.
Thank you very much, Doctor.
Bye-bye.
Okay, bye-bye.
All right, thanks.
See you, mate. You take care.
No problem.
Bye-bye.
My handbag stolen out of my car. My mobile phone's in my bag.
The itching is unbearable. I could literally throw myself off the balcony. I don't know what to do with myself.
Do you think you're having problems with your memory?
Forget kids' names.
Kids that you should know?
Well, my grandchildren.
Okay, fair enough.
How long were you in prison for?
3 months. I've come out today.
No cocaine use?
3 months now.
3 months.
What is it that you're scared of? You just sit back over here. Bring baby with you. Oh, bless. Yeah. Just, yeah. Oh. surgery yet to again. Can I help you? Thelma?
Are you stiff as a...
Yeah, I'm stiff as a... not that cardboard I ate this morning. Not this morning, yesterday. I opened a packet of cereal. You know the cardboard?
Oh, yeah? Oh, really? Bloody hell. That's it. How are you anyway, darling?
Stiff. You just had to do it there, didn't you?
I did.
You just had to.
Look at it coming out
Yeah,
already.
see, I always do it right there on the bone bit. So I felt that one. Oh, did I? I ate
I
this.
woke you up anyway.
Oh, yeah. I'm definitely awake.
There we go, darling.
Yeah, so is there anything on there? I've been put in for a gastric band.
Oh, have you? Lucky you.
Yeah, Dr. Doodove, the old heart specialist here. What's his name? Nanda?
Oh, Dr. Nanda?
Yeah, he's put me in for it.
Oh, I'm going to go and ask for one of them.
He's not your doctor. But I was over the moon. I went home and cried.
That's really good, isn't it?
Wow. Because he knows I'm suffering so much. I mean, all right, I'm 62, but this is going on since 58. No, and I'm just getting worse. And I'm not moving about. Just can't do anything. And I'm 20 stone.
Really?
20 stone on the dot. Dead on, not a fraction over or under.
I've lost 5.5 stone. I went with Slimming World.
Okay, my mother did years ago.
Yeah.
So what did you weigh at your biggest?
The biggest I weighed was nearly 18 stone.
See, you did it all on your own?
Yeah.
That's hard, isn't it? My hard one is bread.
Yes, I don't eat bread. I don't eat bread and I don't eat cheese now because...
They're the two, aren't they?
Mm.
Bread mad. I look at is it a batten? You know, when they're crusty but soft. I look at the batten, I've got to take the end off with my teeth. Because you've got my own teeth, innit?
One good thing, you should have got your own teeth.
Because if they weren't my own teeth, they'd be stuck in the batten, wouldn't they, for my boy to have me go.
Right, I need to see you next week, darling.
Okay.
Okay, because it's gone a bit low. Let's concentrate on this. It's 1.8, okay?
Oh, it's gone low?
It's gone low. So I want you to take 9 tonight.
Yeah.
And then 10 all the rest of the week, okay?
Looks like I'm going back to what I was in the beginning.
Yeah.
Which was 10 straight away.
Which was 10 straight.
9, 10,
Yeah.
10. Yeah.
Right, 30th. What sort of time do you want, babe?
Same time, 11ish. Does me fine. It takes me like 3 hours to get out of the bed. Okay.
Same time, same place.
Same place, same channel.
Yeah. You're right, babe.
I'll tell you what, if he knows that if this doesn't happen, I'll be scooting in here on me. Trolley. Thanks, darling.
See you later. Bye.
You know, you people are really nice to come here and you laugh and you smile at us. For a patient, it's much nicer to see a girl that smiles at her and is polite and makes you laugh.
Don't tell everybody that, because we've got a reputation to keep.
Come on. Keep smiling, girls. You're all lovely. Thank you now. Bye-bye.
How can I help?
This leg is swollen right up.
Okay.
Compared, it's pressing on the jeans at the
Okay,
moment.
take your jeans off. Let's have a look. When did that start?
Oh, I've had it for ages. I've got varicose veins in this leg.
Yeah.
All the muscles.
So over what period of time have you...
Oh, I've had this for a couple of years now.
So what, I mean, have you had ever swelling come up?
Yeah.
And what's happened? What have we done previously?
Well, nothing really.
It's just gone back down again?
Yeah. But it's just staying there now. It's just aching all of the time. I've hardly got any ankle bones showing or anything.
Have you ever had any scans or anything like that before? Any clots before?
Not as far as I know, no. I get a lot of cramp as well.
I mean, it's definitely swollen.
Yeah.
There's always this concern of clots. Do you smoke?
Yes.
There's always concerns of clots. And I just wonder whether we should send you in for a scan just to be sure it's not that. Yeah?
Yeah.
Any breathing difficulties, anything like that? There's a direct number now for suspected DVTs. They check you straight away. I think you might just go straight up there. How long has it been like that for?
About 2 or 3 weeks, and it's slowly getting worse and worse.
Hi, could I have the medical bed manager, please? Hi, it's Dr. Lee here, GP down at Farnham Road Surgery. We've got a 61-year-old gentleman with a left lower swollen leg. Do I just send him down there for after 10 or something? Cheers. Thank you. Bye-bye. Right, sir. You're going to A&E first with this piece of paper, which I'm just printing off, and And then you'll go to somewhere called ambulatory care, who will, I suspect, scan you, examine you. I'm not sure it's a DVT. It doesn't clinically present as such. Usually they're hot and warm and a bit more tender, yeah? But there may be some underlying clot that's causing this, and give up smoking.
Yep.
It's a no-brainer.
Yeah, I know. Especially in my condition.
Yeah, I'm not saying that it's easy to do that, but it would be remiss of me not to say the obvious. Okay? All right, cheers. Take it easy.
Thank you.
Bye-bye.
Bye-bye.
How are you?
I'm all right, good.
Yeah, we met a long time ago.
Yeah, about
mentally.
4 months ago, wasn't it?
Yeah.
Just come out of prison today.
Oh, I see.
So, I need my medical note
Yep.
to give to the council about housing.
Right.
And then I need to get some more tablets. They've only given me up to Friday from prison.
Okay.
So I've been on 30 mil for the last 3 months, every day.
Of citalopram?
That's it, give me a C in it. Yeah.
This letter, where are you going to live now when you...
This is what I need this letter for, to get housed.
Okay, so what did they say? They just released...
They said, they've released, they've released me and saying, basically, I've gone to probation, so I'll go back there tomorrow, but I've got my license agreement.
Right.
But now I need a letter from you to say what's my conditions, so I can show the council. So they said I should be able to stay in a hotel or a bed and breakfast tonight, and then they've got a place for me tomorrow, but as long as I've got all this paperwork.
In temporary accommodation, is it?
Yeah, no, this should be, temporary accommodation. Yeah.
So you've got depression. Is there any other active medical problems that you're worried about?
I've had 2 heart attacks, but that was through my misuse of drugs.
And sometimes I forget, and my memory is short memory getting bad. Long memory, okay.
Did you stop any warfarin or anything like that?
I can't remember. My memory's very bad at the moment.
No worries, darling.
It's been 2 weeks now, I'm off.
And do you think it's helped your memory?
It could be just mine, but it kind of little bit.
Better? Okay.
I forget things so easily, losing memory day by day.
So you think your memory's getting a bit better now?
Yes.
Okay. They discharged you because they felt there wasn't any sign of anything like Alzheimer's or anything like that.
Has that been a progressive problem?
It's sort of lost all the time.
You've had a haircut, mate, have you?
Yeah.
Yes. Good on you. Come in. Come and take a seat over there, mate.
Thanks.
So I had a chat to you the other day because I got a letter from the speech therapists who were concerned a little bit about your memory.
Yeah.
And also a bit of tremor that you've got going on as well.
Yeah, no.
It's not much of a tremor, is it, really?
There's nothing there.
Occasionally people will talk about fasciculation, where the muscles will just be doing strange little movements like that, but... OK, I can't say anything. Do you think you're having problems with your memory?
Short term,
yeah.
Not all the time.
Yeah.
But, I forget kids' names now and again. And
yeah. Kids that you should know?
Well, my grandchildren.
OK, fair enough. Do you ever walk into a room and suddenly think, what am I doing here?
Yes, it's happened once or twice, yeah.
OK. What about things like leaving cooking things on and forgetting about them and that sort of thing? No, nothing like that. OK. So what I'm going to do is there's a test that we can do that sort of tests for memory, yeah? Yeah. And I thought we might run through it and see what happens and see how it goes. Are you happy for me to do that, yeah?
Yeah.
So the first bit is a bit of memory. First of all, you've got to imagine you're going shopping.
Yeah.
OK? And I've got a list of grocery items. So tea, OK, cooking oil, eggs and soap. Can you repeat that back to me?
Tea, cooking oil, eggs, soap.
OK, and do it again.
Tea, cooking oil, eggs, soap.
Good. OK, so just keep that in your head. OK. Right, so what I'm going to do now is ask you to point to different parts of the body for me, OK? Yeah. Can you show me where your right foot is? OK, your right foot, yes?
How's that side of things with the cocaine and?
Yeah, I've been clean, and now I've got a year's drugs test with probation, and I'll be going to T2 again to engage with them.
Okay. Are you on any substitute?
No, it's just cocaine, isn't it? So
Okay.
there's no substitute for cocaine.
No. I just wondered with the were you ever had any problems with heroin?
No.
Okay. So
I've been to rehab 3 times, and
So free of use for, I want to put this in the letter for them, for 8-9 months, is it?
What's this?
The no cocaine use?
3 months now.
3 months. Yeah. How long were you in prison for?
3 months. I'll come out today.
So you've got no pending issues now, court or anything? Okay.
So I've come to sort it all out, really. Because I've been on them tablets for 3 months, and they say it's not good to just come straight off them, is it?
No. Especially now you're out in the community, you'll need them as a way to probably help you. If you suddenly withdrew that, there's too much change in a short time.
Yeah, that's what I thought.
I looked at the heart and we've got no confirmed.
Remember, I was 25 when I had the heart attack. And then I had a mild one 2 years ago.
Because you're not under any cardiologist after that, right?
No.
Did you have an angiogram?
We'll start that thing up yet?
Yeah.
No, I discharged myself.
You never had a stent or bypass?
I didn't wait around long enough.
So it's unlikely because there's nowhere on your record it says that. But it might be that they suspected you had chest pain and they did all the tests to check. But not everyone who has chest pain has a confirmed ischemic heart disease. You would be in a lot of medications. That's what I was surprised when you said you had a heart attack. Your prescription is here for the citalopram.
All right, then.
Okay?
Right, thank you very
Good.
much.
Good luck with the housing, okay? If you run into trouble with that, come back to us tomorrow. But you've got some family support. Worst case, is it? Your sister?
Yeah, I'll stay somewhere tonight.
Okay. All right. See you.
Thank you very much.
Bye-bye.
Okay, your right foot, yes?
Yes.
Okay.
Oh, no.
No. Show me your left hand.
Right.
Okay. Okay, so I want you to tell me the names of as many animals as you can.
Aardvark, kangaroo, rabbit, cat, dog, mouse, cow.
That'll do. Good. You have to get to weight. You've done it. Can you remember those things that I told you before?
Tea. I can't. I've forgotten about them.
Okay, so that's fine. Okay, so in fact, you've got a pretty good score out of that, mate. So I'm reasonably happy with this. It's pretty accurate, this thing that tells us, if people, we're looking at dementia and that sort of thing. So
Yeah.
I'm not worried that you have that.
Good.
So I'm pleased.
Yeah.
From a dementia point of view, you're not anywhere near that.
That's good to know.
What about your medication now? How are you getting on with it?
I haven't got any. I'm out at the moment.
It's been done 2 days ago. I mean, we've signed it. So go and see if those medications are done next door. And I'll give you this other little 10 milligram to go with the 20 you're on. Yep.
Right. Hello.
Okay, mate. You take care and...
Thanks a lot. Thanks a lot.
See you, mate. Bye-bye.
Bye-bye.
Bye.
How did he do?
Oh, he's had a stroke, so...
Yeah.
And actually, he's done remarkably well since then.
Yeah.
But he's frustrated because he wants to get out and do things. On that, he did pretty well. He got something like 26 out of 30, so I'm quite happy about that.
Hello, you gonna give us a smile? Oh, she just gave you a real look there, Emma. Give me 5. Give 5. Good girl. Another one? Yeah.
That's booked for the 10 to 9.
Oh, you want another one before we go? Good girl.
Thank you so much. Thank you. Bye-bye.
How can I help?
You can see by it's just his rash.
Yeah.
It's completely covered all over his body.
Mm-hmm.
He's been taking Piriton.
Mm-hmm.
But he keeps sticking it up. I don't think he likes it.
Is there any discomfort with it?
No, it's not itchy.
No? Okay, so he's quite comfortable in himself?
Yeah, he seems all right, yeah. I'm just feeling itchy looking at him, that's all.
Completely.
Yeah.
And is there anything that he has that makes this worse?
It's only because he started crawling, whether he's getting around in carpet or something, I'm not sure.
So can you just undo his dungarees so we can have a look? Oh, I'm sorry. Okay. And you've not changed your washing powder or soap or anything like that recently? Let's lift you up. Mum, can you just grab his back? Just have a look at that. Okay. Okay. Normally what we'd use is a mild steroid cream just to settle it down, but it's not really going to help us find out the cause of it. So considering he's so young, I think it'd be worth getting the paediatricians to have a look at him to see what they think, to see if they want to carry out any sort of testing. Because he's been weaning onto solids. Is this a food-related allergy? Is it something else?
So just carry on taking the Piriton?
Carry on taking the Piriton, that's not going to do him any harm, and hopefully eventually it will start to take effect. Anything that you think's making it worse, obviously just try and avoid and keep a note of, okay?
She reckons it's me. I don't think he's allergic to me.
Well, I don't think it would take 6 months for it to show.
Yes, that's what I thought. Okay then.
Okay.
All right, thank you, Doctor.
All right, no problem.
Thank you so much.
Don't forget his tummy.
Oh, yeah.
Okay.
Who are you seeing, sweetheart? Do you know?
Mushy?
Mushy.
Mushy?
What is it Mushy? What's his name then? I don't know when she gave me the appointment. Was it Mushy?
Mushy?
What's his name
What is
then?
it?
Ready? It's Moyes, Dr. Moyes.
Dr. Moyes.
Oh, it's like Mushy.
He's like Mushy.
Upstairs, downstairs?
You lie down.
She's upstairs.
Upstairs.
Go.
Yep.
Very much.
It's Dr. Hyder. Come and have a seat. I think I've spoken to you on the phone, haven't I? Oh, were you with someone else before? I'm not sure. Oh, OK. So I've been getting a lot of letters about you. And yes, I have. Because you're going through some uncertainty with what's happening at the moment with your ferritin levels. Has that been confirmed then?
Yeah, they said it was.
Still's disease is very rare, and Thelma is the only case I've seen with this condition. It's a type of inflammatory arthritis, a little bit like rheumatoid arthritis. The classic symptoms are a distinctive bumpy rash, high fevers, and joint aches and pains.
When it got really bad, because I had it for a year now in July, but it got really bad in November. When I went in, they had Still disease on the system, but they didn't say, they said that we can't diagnose you with that because there's still a few things that's uncertain. I was tested for so much stuff.
Yeah. The diagnosis of Still's disease takes a little longer than more common diagnoses because other things need to be excluded first as it's so rare. Initially, treatment for Still's disease is with high-dose steroids to reduce inflammation. And when's your next appointment? It's coming up quite soon, isn't it?
I think it is like next week or something, but I've got one at the Royal Free Hospital next week as well.
OK. Are they a specialist centre for Still's disease, or what was the reason?
They referred me to them. I have to send bloods every month.
Right.
But
More of a specialist unit for that area, maybe. OK, that's fine. So that's your Cetraban and the calcium and vitamin D together.
Yeah.
The long-term prognosis is variable. Some patients have a few episodes at the time of their diagnosis. Some people may be affected in the long term with symptoms of arthralgia, and it can also affect their lungs, liver and spleen. So if anything changes, I mean, they're quite good because I have been getting their letters regularly, but if anything changes and you find out before we get the letter, you can just phone in and let us know what's happening.
That's fine, thank you.
OK.
Yeah, thank
All
you.
right.
It was Dr. Hyder, right?
Yes, that's right, Dr. Hyder.
All right, then, thank
Take
you.
care,
Nice to
then.
meet
You
as well.
too. Bye-bye.
All right, bye-bye.
Okay, down.
Oh, let me have a look.
I've got no idea what that is. I don't know. I think it's one of those things that you use on gladiators. Are you ready? Yes, please.
How can I help?
In all fairness, I don't think you can do anything.
OK. That's really reassuring. Oh my goodness. Okay.
See what? Look, I've got cracks everywhere.
Yeah.
Cracked open all round the back here. Look, it all splits as I walk. And now I've got this all come up. Now, can you believe 2 weeks ago I had the chiropodist. She shaved everything down to a baby's bum. And that's 2 weeks.
Wow.
And it builds up so thick between the toes. It's like Kermit. It's like a frog, you know, I've got thick skin between, so I can't move my toes. I know it's horrendous. I had to live with it.
Sorry, I'm not laughing. I'm laughing at the level of detail you're sharing with me. It's great.
No, I understand. I mean, I've lived with it for a lot, but it's just getting worse. The itching is unbearable. I could literally throw myself off the balcony. I don't know what to do with myself.
I am concerned about this.
Yeah, it's very painful. Last night my foot was all puffed up here. I mean, it was so, and it was absolutely red, and this was all mauve, you know, really mauve, and I couldn't touch it.
You're not having any temperatures, are you?
No.
All right, so we need to give you some antibiotics for that?
Just for that, yeah.
Okay.
The other thing is frightening, actually, very scary. For the last 3 or 4 weeks, I've had the room spinning round.
Right, okay.
And it's horrible because you can't stand up. I can't, if I move my head, it goes flying round. I get ringing in the ears.
Does this only happen when you move your head?
Well, I wouldn't say it's only when I move my head, but it's some natural sort of weird feeling.
Any problems with your speech?
Speech?
Yeah.
I'm going on holiday soon.
Where are you going?
I don't know what it's called yet.
Spain.
Spain. Very nice.
Going to Camber Sands, and apparently you can't go in the sea there because somebody got killed with jellyfish.
I also read that you got every chance for a shark attack.
No, really? Brilliant.
I was in the Navy. My daughter once said to me, "Where have you been, Dad?" Got all the way around places I'd been.
Yeah.
And she said, "Have you been to the Isle of Wight?"
I've come back from holiday at Hulkaduki.
Whereabouts in Greece is that?
It's like 3
Mainland Greece.
Oh,
but
the
on
three
side,
fingers?
3 fingers, yeah. One of those.
Yeah, no, I've been down on one of those fingers, but I can't remember that name, but anyhow.
It's nice to see you. Thanks for coming. How are you?
A couple of things, Beauty. I'd like to know, am I fit for travel? I think I'm fit for travel. You know, because I've got friends in Ireland and all that, you see.
So you're going to Ireland? Is that, and how are you going to get there?
Well, it can be a car ride, or they'll take me over, or a plane.
Okay.
I'm walking reasonably well.
Yeah.
A little bit, you know, wobbly like, but I'm doing my own cooking, my own gardening even.
Yeah. Brindley's recently been in hospital with a condition called delirium, or sometimes known as an acute confusional state, which was due to a urinary tract infection in his case. The symptoms of delirium are behaving unusually or irrationally, having short-term memory loss, having problems with speech, or being disorientated. I'm quite happy for you to travel. Going by, I mean, Ireland's quite a long way by car, so it'll be tiring for you. The plane is obviously much quicker. I would just suggest let the airport know and have someone take you in a wheelchair to and from. They can be quite long distances.
Yeah. Oh, that's the second thing I was going to ask anyway. I was a rep all my life, like, you know, a rep on the road. Now, I have driven that, but not anywhere special. But I feel good with it.
Do you feel comfortable and confident about driving?
I feel comfortable and more comfortable driving than I do walking.
Right, OK. I would say looking at your overall health and your overall mobility and your overall speed of reaction, I would be concerned about your driving, and I would say give serious consideration to sitting back and being chauffeured everywhere.
Driving's in my blood, if that's all I can put it, like, you know, I've driven all my life, like, you know, being on my own in a house, I've got to get up to shops.
Yes.
I mean, I can't walk all that far.
I understand the freedom and the mobility that having a car gives you, certainly. And the last thing I want to do is to take that away from you. But I need to give you my honest view, you know. And I've got concerns, and it's not because of your age, you know. It's just because of your general overall health.
Yeah,
and I wonder about, because driving is a really complex task that we have to do. It involves lots of different things. I've had the pleasure of knowing Brynley for 17 years since I started as a GP in Slough. So I've seen Brynley retire and enjoy his retirement, and I like to think we have a really good, friendly relationship. My concerns about Brynley's ongoing ability to drive is related to his mobility and the speed of his reflexes. So even though mentally I think he can see the dangers and what he needs to do, I'm concerned that his body couldn't respond quickly enough to take action that he might need to do.
And I hope you don't mind me bothering you.
No, I hate to be bothered. OK, right, OK, nice to see you. OK, nice to see you, take care.
I understand you've got CCTV out there. I had my car, I've had my handbag that's stolen out of my car. My mobile phone's in my bag. Wait a minute. Okay, don't worry. My bank cards, everything's in there.
Where was the door open?
No, my bloody window was down. I don't know how. I must have been.
Is this blue one yours?
No.
Oh.
Where that car just driving out, it's just there.
Take a breath. Have a sip of water. Okay.
Any problems with your speech?
Speech?
Yeah.
Oh, what, do you think I've had a stroke or something?
No, I'm just need to rule out things. All right, we're gonna have to check you over. Okay, that's better.
What's it like?
It's good. Let's just have a look in your ears. Okay. Okay, wait, I'm not done with you yet. Okay, follow my finger with your eyes. Hands out in front of you. Okay, just raise your right leg off the floor.
Oh, God, now you're talking.
You have difficulty in balancing?
I do fall over sometimes.
Okay. Have a sit down. I won't make you do any more.
Oh, God, I'm sorry, darling.
I think you've got something called benign positional paroxysmal vertigo, BPPV. What this condition is, it's what you're telling me. So when you move your head, you get the sensation of the room spinning around you. So basically, inside your inner ear, you've got these very fine hairs, and on these hairs lie some crystals, okay? And they help regulate part of the balance system. Sometimes, for some reason that's unexplained, these crystals become dislodged. Often this will settle, the crystals just automatically align, and you're back to normal. So it can just be about a little time. If it's going on for too long and it's really disturbing, we can try different manoeuvres, different techniques to try and get your head in different positions to realign the crystals.
It's so scary, you know, it really is. And when you're living alone and everything, you think, oh my God,
you don't drive, do you?
Pardon?
You don't drive?
No, thank God.
Okay.
That'd be a menace.
So let's see how it gets on. If it hasn't settled by the time you come see Dr. Ree, we may need to try this manoeuvre, okay?
All right, darling.
All right?
I'm sorry to have taken so much of your time.
That's okay.
I'm sorry I talked too much. I'm sorry.
That's okay too.
I haven't wasted your time, have I?
You will never waste any of our time. Please
No, I
don't
do.
say that.
I worry about. I know how busy wasting your time, really.
Well, it's not a waste of time if you've got a problem. Take care. Bye-bye.
I need to cancel all my bank cards and everything. I don't have it. They have my mobile number. I do, but I don't know what it is. Yeah, it's just that couple, they just look really suspect. I've gone in there and because they were rummaging around and then they just walked off. They knew I was distressed. And then I shouted after them and they just stopped and they looked around and said, what? And I said, did you see? I don't know, it could be in the boot. Hello?
Any Matty? Come on in. Hi. Come on, have a seat. How can I help?
Oh, yeah. I met Dr. Jamil 2 weeks back.
Yes.
And my thrush in the vagina has not gone away.
Right.
When I stop using the thrush cream, it comes back. I thought for 1 week, and I did, there was irritation all around and penetration and any, sex was very difficult for me.
Right.
And I have to change 2-3 underwears. in a day because it's I keep cleaning it up and.
So she did a swab, which was okay,
yeah.
wasn't it?
So what was the swab?
The swab's normal.
Yeah.
Okay. You had an ultrasound scan as well, didn't you?
Yeah, that's true. Yeah, but that she wanted to see whether there is some kind of a liquid around in the area. I had a hysterectomy.
What symptoms have you got? What does it feel like?
It's just like the secretion, and it's like a white discharge, quite watery. It is not jelly type, but it's more watery, but white.
Can I have a quick look?
Yes, please.
And any problems with your waterworks or anything like that? Passing urine? No?
Not at all.
Get yourself dressed again, yeah? That's fine. It all looks pretty good there. I think it might be a bit of estrogen deficiency. Have a seat there. Do you... Oh, really? So I think we can probably make you feel more comfortable with some vaginal estrogen tablets. Estrogen deficiency most commonly occurs at the time of menopause. It occurs because the ovaries start to fail to respond to the hormone, which is encouraging ovulation. Ladies experience a range of symptoms, most commonly hot flushes and poor sleep, anxiety sometimes, and vaginal dryness and urinary symptoms.
I mean, you have to insert it.
You just put them high into the vagina at night time.
But being diabetic...
That's fine.
That's fine.
That's absolutely fine. Not very much is absorbed into the system. The tablets just work where they're inserted, so in the vaginal area, and they have quite a positive effect on the bladder as well. So I think that will make you feel a lot more comfortable.
My bladder leak.
Really?
Sometimes,
I think this might be the thing
when I
then.
cough or sneeze or something.
I think it might help that too. Will you come back and have a review when you've run out of them?
Yeah, sure.
Okay. I think that will help quite a lot.
Thank you very much.
Thank you.
I did 8 miles this morning without stopping. God.
Oh, Nick.
Ugh. I look like I've been in a shower. And when I was running, there was this man in the tightest lycra bodysuit I've ever seen. I saw everything. But he was a runner.
Was it like a bag of Brussels sprouts?
Yeah, he was a runner. Yeah, well, I've got a bag of oranges there, to be honest.
While he was running?
But he stopped and he was clapping me and he was going, go on, you can do it. So I was running.
I say I would have done it quicker if you weren't wearing them.
I was like, oh. Hello, Leslie. In you come. So this is to check your blood pressure, because we increased your irbesartan back up, didn't we? Because your kidneys were back to normal.
What did they say you've got? What's your diagnosis?
Avian lung disease, so hypertensive pneumonitis.
Hypersensitive to birds.
They told me to get rid of my birds because I had about nearly 500 different types of birds. I went over to a friend of mine this weekend, and she suffers with similar to me. She gives births and all that. And she had...
A nebulizer?
One of these.
Well, it's similar, isn't it? It does the same thing.
Ionizers with salt.
No, that... Oh, right, so that's just steam for your lungs, really, yeah?
It took, while I was there for 3 or 4 hours,
it helped.
It helped the breathing.
A nebulizer has drugs in it. Yeah, the ionizers are just water.
Can I just...
Sorry,
Will you ask me to come?
Yeah, please.
What Les is saying is that when he tries to take his Ventolin or whatever, he can't suck it in.
I just can't suck.
Let's see if we can get the nurse to have a look at you and see, yeah? You don't have a nebulizer at home, though, do you? You've always had your medications through inhalers, yeah?
But they're quite easy, aren't they? Because you can just put the mask on and it comes out in a mist.
No, it's OK. We're going to talk to the respiratory nurse about having a look at you. Now, she certainly should be able to do that sooner rather than later, yeah?
It's getting terrible, doctor. The night I can't sleep. Oh, no.
Yeah, you've given him those 2 sleeping tablets.
I haven't put him on
Or
2
you've
sleeping
increased-
tablets. It's an antidepressant.
Antidepressants, right, so it's not a
Side
sleeping
effect
tablet.
is that sometimes it makes you sleepy,
Yeah.
but that's not
Oh,
what
right,
it
it's
is.
not doing
It's an
that.
antidepressant.
It's not making him sleep, and that's what's frustrating him. He's not getting any sleep.
You know that it's difficult to give you straightforward sleeping tablets with your lung problems, yeah? Are you any less anxious than you were?
Is it?
Some tissue.
Leslie. What is it that you're scared of?
I can't breathe. I can't breathe. He keeps coming up with this massive thing on his face.
So what that would suggest to us...
It's an allergic reaction.
It is, yes.
My poor baby.
I seem to be allergic to everything. Tomatoes, vinegar, oranges, citrus fruit, strawberries.
What about nuts?
I haven't tried them.
He's got all these lumps and bumps come up on his hands.
It looks like an allergic type reaction, like a heat rash, but it's not quite a heat rash.
I'm allergic to hay fever.
Are you taking anything?
Not for the hay fever.
Bit of a rash.
Okay, I have those strawberry allergies. You're also not the first person this morning who might have had a who's eaten strawberries and come out in a rash. That's why it's in my mind.
Leslie, sweetheart, I need you to breathe, yeah?
Sorry.
So you don't feel like you're getting the Ventolin in because you're struggling to take it, yeah? Take your time and come back across, Leslie.
See, the thing is, you need to say to her what you're frightened of, because you're not frightened of... Yeah, but you're not actually frightened of dying, are you?
I get up in the middle of the night.
Yeah, but you're not frightened of dying.
No,
so
I'm
what are you frightened of?
I'm afraid I can't breathe.
Right. There's a nurse around this afternoon who can do your nebuliser. Let's see how your breathing is after that.
The other thing is I wake up in the middle of the night and I cannot breathe at all.
Right.
I don't know whether to phone the ambulance, wake my brother up and go to A&E.
Right, OK. I think if you're that worried that you can't breathe, you call an ambulance.
That's what I said to him.
Nothing else that any of us can advise you, because we're not there with you.
No.
Yeah? If you can use your inhaler, that's what you should try first. But if you can't, then what we need you to do is we need you to call an ambulance to get some help.
Well, he sat out there just a minute ago, and I said, what are you frightened of? I said, because you actually say that you're not frightened to death, and he's not. But he just doesn't like that feeling of not being able to breathe, which is fair enough. But, I mean, then he gets depressed and says he'd just take a load of tablets.
I've taken gabapentin.
You've taken an overdose, Leslie?
No. Well, he takes loads of tablets, more than he should.
He's the pain.
OK, Leslie, I think you're getting into a real muddle, and I think you're taking things that aren't the right things for your condition. You were in hospital with your heart, yeah? And they did all of the tests, and they're seeing you again in outpatients, and you're having your pacemaker done. We need to get you so that you're using the right things, yeah? So when you're breathless, when you're wheezy, you need to be using your inhalers if possible. When the gabapentin you just take as a daily dose, like you take your blood pressure tablets, you don't munch extra blood pressure tablets, you don't munch extra gabapentin, yeah? You take them as it says on the box, yeah? Let's try you on an inhaler now.
Sorry,
the nurse will be
doctor.
waiting for us.
Sorry, I apologise.
Don't be silly.
He can't get up to bed, so he's sleeping on the floor, and then he's so big he can't turn over properly. See how you might feel better on this. You might get in a little bit.
Have a seat. Sheila will come back when she's free and do the nebuliser, and then I'll see you when you've had that done, OK?
Is Mum at work today?
Mum's travelled.
So you're having daddy-son time together?
Oh, of course. Yeah, when we get home, you can have a biscuit. So if you win the pot for Daddy, I'll give you what you want. Is there anything else you want to say to the doctor?
Yeah.
Are you sure?
Yeah.
That's good. I like your smile.
Very pretty smile.
You ready, Daddy?
Yeah.
Okay. You okay?
Yeah, I'm fine.
Hello.
Yeah.
Hello.
Hi.
So little one's here for her first injections. Okay, so it's 3 injections today. So it's this one, diphtheria, tetanus, pertussis, polio, all combined there. This one's for pneumonia, and then one for meningitis B. Okay. And then this one is medicine that goes in the mouth. Okay. So Mum didn't want to come in then, she's left you. Sometimes mums get a bit upset, don't they? Yeah. pull that out a bit for you. Right, so if you just sit back over here and just hold it as you... Bring baby with you. Oh, bless. Just... Oh. Okay, so she will cry, okay? Oh, no, I'm sorry. Oh, no. That's it. Fine, give her a nice cuddle. She's fine.
No. You made me cry.
That's why Mum sent you in. It's not...
baby. What did they do to you? Did it make you feel bad?
Well,
You
it
get used to
used
it,
to,
I suppose,
yes, I'm
yeah.
sorry, but yeah, you've got to kind of think it's for their own good in the long run, isn't it? So, yeah, so, no, I don't feel bad anymore. Okay, so just carry everything as normal, but just give us some regular Calpol, all right?
Okay.
All right, then, take care. Keep her nice and cool, that's a good idea. Okay, bye-bye.
Okay, lovely.
Thank you.
All the best.
Thank you.
Yeah. Bye. Bye, Olivia. Bye-bye.
Okay, lovely. Thank you very much. Take care. Thank you. Bye.
See you soon. Have a nice evening.